The U.S. measles outbreak has reached its highest level in 25 years. Just Monday, the CDC confirmed 10 new cases. And as the school year begins, many parents worry the outbreak could worsen. The California Department of Public Health says immunization rates remain at high levels but have decreased over the last 2 years. In the 2018-2019 school year, 94.8% of kindergartners were fully vaccinated. This morning, our continuing coverage takes us to San Jose, where it is the first day of school there. KPIX 5's Jackie Ward is getting us up to speed on current state law when it comes to your kids' shots. Jackie?
Good morning, Michelle. Well, right now, the way the law stands in California, it requires every student in California to be up to date on their vaccinations, regardless of if they go to public school or private school. So parents can get a medical exemption, but they can't get a personal one. We spoke to a nurse practitioner who tells us which vaccinations are required and recommended. California is one of 4 states in the country that does not allow religious or personal beliefs that will prevent children from getting their shots. Students can only go to school unvaccinated if they are medically exempt. Sarah Delator is a nurse practitioner at Minute Clinic in the Sunset of San Francisco. She explained to me why everyone who is able to get vaccinated should.
I would recommend if you have a medical exemption, it's totally necessary, but it's called herd immunity, and with vaccinations, we're hoping that all the healthy people that do receive these vaccinations can help protect those who aren't able to receive them.
If your child is going to kindergarten, they'll need the vaccine for polio, DTaP, MMR, varicella, and hepatitis B. For 7th grade students, they need Tdap booster, varicella, if they didn't get 2 doses prior. And while not required, the CDC also recommends 3 more: the flu shot, the HPV vaccine, and meningococcal conjugate vaccine for all preteens and teens. Delator says meningitis comes in both a viral and bacterial form. While the viral form is more common, the bacterial one still exists and can be deadly within 24 hours of contracting the disease.
Very quick. I would recommend as soon as possible. If a practitioner notices these symptoms, they're going to want to get a spinal fluid or some blood work done, and then after the diagnosis is made, hopefully IV antibiotics can be started within 24 hours.
A couple of other meningitis symptoms include a really high fever, a sudden headache that's really intense, and also a couple other really severe ones. So if you have any of those, a really stiff neck, that's the one I was trying to remember. If you have any of those symptoms, it's best that you call your doctor right away because they'll probably want to get a blood sample or a spinal fluid sample. Live in San Jose, Jackie Ward, KPIX 5.